Let's continue the conversation now with Standford Children's Health Physician, Dr. Alok Patel. Always good to see you in the morning, Doc.
Likewise, Kira, good to see you.
All right, so as we just heard Whit say, the FDA has approved Moderna and Johnson & Johnson boosters. We know the rollout for the first vaccines was a bit confusing. So how do you think this is going to go? And how soon do you think they could lower the eligibility age for the booster as well?
Well, Kira, it definitely is confusing. And, you know, when some people see those confusing headlines, it gives them pause. But I actually hope it gives people some sense of security and understanding how much data these experts are going through, and the fact that it's multiple committees combing through so much data about safety and efficacy and who exactly should be getting these boosters. Now, I expect that the recommendation coming from the CDC is going to be in line with the FDA. The small thing that I'm curious to see what's going to happen is who exactly they're going to recommend mixes and matches those Johnson & Johnson boosters, which is what Whit was alluding to when he said there may be some confusion there because, you know, yes, the data on paper show that people who got Moderna or Pfizer after Johnson & Johnson shot had an increase in antibody levels, but the increase in antibody levels doesn't necessarily correlate to how well you do in the real world and how well it's going to do over time. So that's the one thing that we're waiting to see what's going to happen if they recommend, you know, certain groups get Moderna versus Pfizer if they've already gotten Johnson & Johnson. But I do think the Moderna booster is going to be right in line with what the FDA said and what we just heard. And obviously, CDC Director Walensky tomorrow Friday will put the final stamp on it before it goes into policy.
All right, let's talk more about the green light for the mixing and matching vaccines and the brands. Should people go ahead and get a booster shot of their choice, or do you think they should try to stick to the original brand that they received? And is mixing and matching actually better, or are there any health concerns with mixing and matching vaccines? I know that's a loaded question. There's a lot there.
I was like, here, you're coming with it right now in the morning with this question, but it's a great one. You know, so it's not a new concept, you know, heterologous priming. When I talk to my immunology colleagues, all of them are saying, yes, there's a lot of science historically to show that this does work. You're basically giving your immune system different versions of a vaccine just to get a better immune boost. Now, if you think about it, Johnson & Johnson works as an adenovirus vaccine, and it's a different method, the mRNA, which we would get from Pfizer or Moderna. So what studies have shown is that if you get the mRNA after getting the DNA-based vaccine, you have a great response. And there was a previous study with AstraZeneca and Pfizer showing this in Europe. And so, you know, if right now, if someone were to come to me and said, you got Johnson & Johnson, you've got to pick a booster, what are you going to do? I'm going to go with what data I know, and I'm probably going to get Moderna or Pfizer. That doesn't mean that people out there aren't going to get great protection if they just get a 2-dose series from Johnson & Johnson. But one thing that I haven't heard a lot of speculation about is how this is going to improve vaccine delivery, because the way I think about this, if we have a mass booster site, let's say there's a supply of vaccines going to a nursing facility or a hospital, it's a lot easier for those officials to just bring one batch of vaccines and then try to match the vaccine with every single different booster needed for people. So I think that's another element here, is the flexibility and the ease at which we can get boosters out to a large group of vulnerable individuals.
What about side effects after having a booster shot? Because we had side effects when we had either our first or second shots of the vaccine. And then also, you know, it's time to get our flu shot. So can we mix that into all this as well?
And side effects, anytime someone brings up side effects to me, I'm like, yes, because after my second Pfizer shot, I was out for like 24, about a day. Now, I think it's important for people to remember that these side effects, by and large, are expected. This immune reactogenicity we're expected to have is your immune system revving up, getting ready to go to battle if it has to. But that's an important discussion that's going to happen today with the Advisory Committee on Immunization Practices, is are there any side effects that people should be concerned about? And is there, you know, kind of a general recommendation people should plan a booster when they don't, you know, may not have a large day of work after it. But so far, all the safety data does show that it is safe to get the booster and there's no increased risk. But again, that's why we wait for this final approval. And regarding the flu shot, Kira, you know, the recommendations changed about maybe a little bit more than a month ago, saying that it's absolutely safe, if not recommended, because you're already at the doctor's office, to get both the flu shot and the COVID booster if you haven't gotten one of them already. And I just have to add that extra PSA here, is that this is a different flu season than last year when we were locked down by and large and people were wearing masks. We're reopening, and we may very well see a flu season matching that of 2019, where we had thousands and thousands of people die and many more get hospitalized, which it all comes down to, aside from just the illness and death, but it comes down to us having a close eye on our healthcare systems. I'm already seeing influenza cases right now, and it's not even November.
Wow. All right. Well, it's time to get the family the flu shots, it sounds like. Also in the UK, admissions to hospitals and deaths are on the rise despite the high vaccination rate. So do you think the U.S. is likely going to follow in the same pattern? And also there's continued fear of variants, too. Are the booster shots being changed to match these emerging variants?
Well, here, in order to sound smart, I just glanced at my notes to make sure I knew the name of the variant, the AY42, which is a Delta subvariant, which scientists are tracking right now in the UK. And from the data I've seen, it represents about 5 to 6% of those new cases out there. And so it's too early to say this is a variant of concern, but there are some people who feel that it may be more transmissible. Way too early to say anything, but I think the important cautionary tale is that variants can arise. And they can absolutely, make themselves known if we continue to let the virus replicate. Meaning, if we continue to let the virus swirl around from vulnerable, unvaccinated populations, it can develop mutations. It's something that everyone is afraid about. Now, in the UK, they had a very successful early vaccination program, which a lot of people got vaccinated a little earlier than they did in the United States. And one theory is that some of the antibody protection may be waning right now. On top of that, they've been completely open for the past 3 months. And not a lot of their teens have been vaccinated either, which adds just another can potentially go out there and spread the virus. So a lot of different variables there, but I think the important thing to know is that this is where some other countries are headed if we aren't careful, including the United States, which is why when people say to me, hey, cases are going down, shouldn't we just start celebrating? We're like, not yet, because the last thing that the virus wants to do is go away.
All right, so I feel like I just went to COVID medical school. Dr. Alok Patel, thank you so much. I appreciate all the information.
You were already there with those questions. I was like, Kira knows it all.
I get a lot of help from some awesome producers. Thanks, Doc.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.